Hello class, this is Miss Turpin. I wanted to record the last part of our respiratory video and put in there for you to watch in terms of our content from class that we weren't able to complete the other day. I know we kind of ended up beginning to talk a little bit about chest tubes. Just wanted to mention that, usually we're trying to get fluid or air, whatever it is that's pressing against the lung and is preventing the lung from full expansion, is the whole purpose of a chest tube. It may be blood, it could be fluid that is collected because of a cancerous growth, it could be surgical intervention in the chest cavity that's caused fluid to collect and has compressed the lung. It could be from trauma because of an injury where ribs are broken or different things like that too that may cause fluid, edema, swelling, bleeding, different things in the chest cavity that then press in on the lung itself, and then the lung cannot fully expand. So, having the chest, having the x-ray and often a CT scan to kind of determine the best placement of chest tubes is very important prior to even beginning. Just a little familiarity with chest tube chambers. The first chamber collects fluid that is draining from the patient. The second chamber serves as the water seal that prevents air from re-entering the patient's pleural space. And then the third chamber is the suction control of the system. These are the indications from for use of chest tubes, is like to evacuate the air or fluid, as we just talked about, to really reestablish lung expansion and breathe, and to restore the normal breathing dynamics. And then also occasionally there is blood collected, which they consider autologous, meaning from your body, that is maybe used for reinfusion purposes post-operative. So occasionally you will see a chest tube set up like that as well. This is just a good video to watch. I won't play it for you here, but I'll let you look at it yourself. And it just really kind of shows you the typical way that an atrium chest tube drainage system is set up. Obviously, when we spoke about lung cancer and non-small cell being a huge percentage of cancers that are found very late stages, this means that often palliation, meaning just trying to kind of make the situation comfortable for the patient, are the goals of therapy. Obviously, lung cancer patients who don't have good oxygenation need oxygen therapy. They often need drug therapy for pain control, for anxiety mediation, sometimes for prevention or treatment of infections of the lung. Radiation therapy we already discussed. Thoracentesis or pleural drains are sometimes put in patients as well. This may be a little different than a chest tube. Sometimes you'll hear people refer to this as a pleural drain or a pigtail drain, and they may actually have just a little bitty small drainage tube that comes out of the chest. And when they have a fluid buildup from the cancer growth, they may have a mechanism for hooking that up and creating a suction type drain just temporarily to kind of relieve some of the pressure of that and improve their breathing. Even though it's a temporary measure, it does perhaps give them a little bit more comfortable existence or quality of life while they're managing the end stages of their disease. Obviously, dyspnea management, how do you be able to do the activities of daily living? Sometimes this requires doing small activities in longer rest periods, how much oxygen to use when you're doing different things. And then pain management goes without saying with cancer, but there is important to note that, at some point with respiratory disease and pain management, there is kind of a marker in terms of, we know that high levels of opioid pain medications may be needed for treating cancer pain, but it also is, as we've already discussed, highly risky in terms of being able to create respiratory depression. And at some point, when it gets to the point where you're giving narcotics and it is, all you can do to control the pain, there comes the realization that at some point this is really knocking out the patient's respiratory drive, and that is where a lot of training through hospice care in that setting really, there is certification in end-of-life care that you can be obtained, and it really helps one come to grips with that at sometimes pain management becomes more important than whether it is reducing the respiratory effort if you're trying to allow someone to have a peaceful death. So just be prepared to kind of notice that some points that the pain management may also become a depression situation for your respiratory status, and that is okay at that point. I want to go through several different infectious respiratory diseases. We've talked about pneumonia, prevention primarily with post-operative care, which is a big piece, but there's lots of other respiratory diseases that can be infectious, and I'll just run through a few here to familiarize you with them. Sinusitis, a lot of people have had this, know what it feels like firsthand. Often the bug of choice may be from a flu, or it may also be from strep. And then, of course, you have inflammation in the sinus passages and mucous membranes. This is usually treated non-surgically with broad-spectrum antibiotics, usually put on analgesics that control pain and fever. Sometimes you'll get decongestants, as well as, use a vaporizer to kind of get some mist in the air to kind of open up your sinuses. Some people do well with using either hot or wet packs over the sinus area or doing saline irrigations. And some people kind of help prevent getting sinusitis from doing that as well. And anytime you have most infections, you're going to want to increase fluids. That just kind of helps thin out some of the secretions that you're seeing. Rhinitis is different from sinusitis because it's dealing with just the nasal mucosa, not the sinuses. Lots of people have hay fever and allergies, and particularly as we get into the spring and the fall of the year, different types of allergies will create, inflammation in this area, causing nasal irritation, congestion, sneezing, headaches. Usually these are treated with antihistamines. Sometimes they're put on decongestants, antipyretics for fever, an antibiotic, sometimes just supportive therapy. And some people tend to use a lot of things that will kind of prevent rhinitis by starting every hay fever or allergy season with taking something like Zyrtec to kind of take daily to kind of prevent developing this, or preventing the severity of it if they do get it. And other alternative therapies like vitamin C and zinc are good for wound healing, and people tend to think that this will kind of help them, prevent or minimize the symptoms of rhinitis. Pharyngitis is just similar, but it is sore throat that's inflamed the pharyngeal mucous membranes. People often have difficulty swallowing, may have fever. Strep throat can lead to some serious medical complications. So because of that, often when you come in with a sore throat, they want to do a rapid antigen test, which screens for strep throat, and it can tell you in like 15 minutes. So occasionally there's some false positives, negatives with that test, but generally it's pretty effective in finding strep throat. And I know we talked about epiglottitis is really severe if it really closes down the throat, but it's kind of a rare complication. Tonsillitis is also another inflammatory infection disease of the tonsils and the lymphatic tissues. It is contagious, airborne infection that's usually bacterial in nature. Patients are usually on antibiotics for 7 to 10 days, and depending on how severe it is, surgical intervention for a tonsillectomy might be done. Peritonsillar abscess is a complication of tonsillitis. This may be where you have pus causing one-sided swelling and deviation of the uvula. The patient may have difficulty breathing. They may have bad breath and really swollen lymph nodes that are sometimes very large. They can treat this by doing a needle aspiration of the abscess and putting the patient on antibiotics. This is just a picture of what it looks like inside the throat if you're looking for that or someone's complaining. Laryngitis is another inflammation. This is the lining of the larynx, and sometimes possible edema of the vocal cords. With this, a lot of people have had this hoarseness, dry cough, difficulty swallowing, and sometimes a loss of your voice or aphonia for a short time. Treatment's really focused on relief and prevention, letting your voice rest, using steam inhalation. Sometimes they're using throat lozenges for the cough, but also some like Cepacol that have sort of a numbing effect to the throat, which is good if it's very painful. And then, of course, reduce use of alcohol and tobacco when that's going on. Influenza, we're getting ready to start in the influenza season, which starts October the 1st. We all are required, and most healthcare agencies now require their workers to be vaccinated annually to not prevent it for the workers necessarily, but prevent the workers from getting exposed and then being carriers of a sense for a period of time until they get sick, and bringing that to hospitalized sick patients. So most of you will be getting that done here very soon. Of course, this comes from a viral respiratory infection, and these are the symptoms: headache, muscle aches, fever, chills, fatigue, weakness, complete, decreased intake or anorexia. Treatment, of course, really consists of, fluids, things to treat the symptoms, and they can be placed on Tamiflu as an antiviral agent, but only if the patient is within 24 to 48 hours of when the symptoms began. If the patient has had the symptoms for longer than 48 hours, then Tamiflu is not usually effective in reducing the symptoms. And this doesn't make the flu go away. Even if you take it, it more minimizes the severity of the disease. You can have what's called pandemic influenza. This is when it's mostly prevalent among animals and birds. The viruses that are common to them mutate and become then infectious to humans. And swine flu is an example of that. And again, antiviral drugs are given, and these patients are usually put on strict isolation.